to as many as 9 million people, up to $1.4 billion in the 2011 plan year, and up to $4.9 billion in the 2011-2013 plan years. Agents and brokers are heavily lobbying for special exemption for being included into the medical loss ratio calculation. The fact is, some agents and brokers are really providing valuable and helpful services, and I happen to agree with that statement. But they, like other costs within the insurance products, they should compete and keep costs competitively low as possible for consumers. At a time when everybody's being asked to tighten their belts and find and create efficiencies, asking for an exemption from these pressures, particularly at the expense of consumer pocketbooks, is not something that I think the consumers will take kindly to. Mr. Potter, would you please talk to us about the dangers of exempting agent and broker commissions from the medical loss ratio calculations and what types of commissions that they have been getting over the past years?
Thank you, Congressman. Yes, if they're exempted, it will be, as I said in my testimony, really a gift to the insurance industry because it will give them just one more way that they can meet regulations that they could already be meeting if they were to reduce benefits, reduce premiums, or if they were reduce spending in some of the many other areas of spending. McKinsey & Company did a study a few years ago showing where most of these companies' administrative costs really are, and they are in underwriting, they're in sales and marketing, and things of that nature. So my own salary, for example, was an administrative expense. In fact, I was talking to someone in France not long ago who said my job was unknown in the French system, and I could understand that. But there are a lot of other places where cuts can be made. And yes, I agree with you. I think brokers, agents and brokers have indeed provided in many cases, good value to the people they serve. But they do get their income from insurers, and they have been paid handsomely. And I think that they should be expected to give up some of, to sacrifice just as much as everyone else.
Thank you. I've got a bunch of questions, and I apologize. I don't mean to curtail your testimony. Ms. Quincy, Consumers Union expanding the consumer protections indicates that that this has had a negligible impact on premiums. My colleagues on the Republican side claim that this is an enormous burden to health plans and employers, and use that as a rationale for repealing key elements of the Patient's Bill of Rights for many people. First, and these are yes or no if you can, please, do you agree that the new consumer protections are imposing a huge burden on health plans and employers or not?
I do not.
Okay. Do you have any estimates or examples of how much these provisions would cost?
Yes, I'd like to refer the committee to my written testimony, if I can find the page. We provided, I think, 3 or 4 sources that cited some actuarial estimates about what the cost of the various consumer protections are. And I think I have to go one page further to get there. Here we go. So in the written testimony, I talk about the fact that federal agencies have estimated that ending annual and lifetime limits will increase group premiums by about 0.5%, and it will increase non-group premiums by less than 1%. Prohibiting pre-existing exclusions for children is estimated to have a negligible impact on premiums. A recent Anthem Blue Cross Blue Shield filing for the individual market in Connecticut shows that the new protections from unjust rescissions have had no impact on premiums, and ending lifetime limits has also benefited consumers without raising costs. And for the sources for those statements, I refer you to the written testimony.
Thank you. Now, Mr. Potter, very quickly, can you discuss insurance company practices with regard to individuals with pre-existing conditions prior to the passage of the Affordable Care Act, and what can we expect since the passage of these new protections? In other words, what's it going to do to costs, what's it going to do to consumers, what's it going to do to industry?
Insurance companies for many years have refused to sell coverage to people with pre-existing conditions, and it is something that continues to go on right now, except for children. That already has gone into effect. A Chattanooga newspaper recently disclosed that Blue Cross and Blue Shield of Tennessee, a nonprofit supposedly, refused to sell coverage to about 1/3 of applicants because of, largely because of pre-existing conditions. It's been something that's been a leading reason why we have now more than 50 million Americans without coverage. And it doesn't matter whether you're rich or poor. I once found...
You just don't get insurance if you got a pre-existing condition.
Exactly. If you've got a pre-existing, you're just out of luck, even if you were born with that pre-existing condition.
Okay. Now, I guess my time has expired, Mr. Chairman. Thank you.
Chair, thanks, gentlemen. Recognize Vice Chairman Dr. Burgess for 5 minutes for questions.
Thank you, Mr. Chairman. You know, done a lot of thinking this summer about the summer of 2009 when we all went home after this committee passed H.R. 30.